Today, I'm going to talk about plantar fasciitis. Now, lots of people have plantar fasciitis and pain associated with it, and it is a career ender for many people. People that are on their feet a lot, such as nurses, people that work in grocery stores, in retail, they are on their feet a lot, and plantar fasciitis can act up. Now, one of the things that is the best that you can do for this is to get good shoes. I mean, good arch support, good shoes, good insoles are huge. They go a huge, long way towards eradicating this type of pain or preventing it from happening. Now, this is probably the most common cause of heel pain is plantar fasciitis. And it often involves inflammation of a thick band of tissue that runs across the bottom of your foot and connects your heel bone to your toes. And I've actually got that right here. I'm going to show you a picture of this. Okay, here we go. So here you can see this is the band that gets inflamed. This is the plantar fascia right here. And typically the pain is focused on this area of redness that you can see right here. This is what really bothers a lot of people. So plantar fasciitis is often causing a stabbing-like pain, and it usually occurs with your first steps in the morning, and as you move, it's going to decrease. And this is because the kind of pain is you're becoming accustomed to the pain a little bit, and the tissue, the fascia, is getting stretched a little, so it's less tense. But it may return after long periods of standing or when you stand up after sitting. If you want to break this down, and this is going to apply to so many different treatments, itis simply means inflammation. So if you have a condition name in Latin that has itis at the end, it means inflammation. Any condition that ends in this, in itis, is the result of inflammation in a given area. So in this case, the plantar fascia is inflamed, equaling plantar fasciitis. So as time goes on, inflammation like this you got to think of inflammation like real fire, right? It burns like a fire. And like a fire, when you've put that fire out or when it's been extinguished, the damage is still there. It's burned up whatever is in the area. So this becomes a long-term condition. So even when the pain has gone, right? Even when the pain is gone, the inflammation has turned off. People are then left with damage that can then lead to a different kind of pain and discomfort, which is much harder to deal with. And eventually this can lead to loss of or limited function as well. Now, microcurrent treatment for plantar fasciitis is a simple and effective process to reduce inflammation in the tissue and to help reverse the damage caused by the presence of that inflammation. So it's helpful to start by painting the area with the scalar chi, if you happen to have one. Now, the scalar chi is easy to use. You set up your scalar to 7 to 12 hertz, and you move it over the area at max power. And just doing this for 5 minutes can make a big difference in kind of unblocking this pain. It's a phenomenal tool. It will essentially reset the body on a cellular level. But if you don't have it, it's not required. We didn't always used to have the scalar, but we've always been able to treat plantar fasciitis. Okay, so you could skip that step if you need to. Next, if you're using either the Genesis or the Evolution devices, you're going to want to set your device to either blue stimulate or 350 hertz respectively, okay? So blue stimulate for the Genesis, 350 for the Evolution. Set it to a comfortable power level, which is often going to be quite high on the bottom of your feet, and paint over the area, okay? You want to make sure you're painting that area and from the bottom of the foot, and mostly in the bottom of the foot by the heel, but you want to go up as well because you want to clear out any active zones. After resolving these sticky spots, you're going to want to place conductive pads on the bottom of the feet. And I've got a slide to show you that pad placement right there, as you can see. So it's pretty simple. You just want to make sure that you've got one pad on the heel and one further up near the toes. And you place these pads there, and you want to run the device at FM RSI if you have an Evolution, or Sana cycle if you have a Genesis. And you want to set it to a comfortable power level and treat for upwards of 20 minutes, okay? That's treatment, nice and easy. Now, if you're using the new Avazia Life Pinnacle device, all you need to do after the scalar treatment is set your device to Sana Pain, the Sana Pain mode, okay? and paint the area to clear out active zones. Then you're going to follow up with 1 to 3 cycles of Santa pain using the pads. What I want you to do, and this is something you should get used to, you new Pinnacle users, is to check in between cycles. So when I say 1 to 3 cycles, you want to make sure you do 1 cycle, and it's going to tell you the cycle's complete. See how your foot feels, okay? If you've got some improvement or significant improvement, stop treatment, and then you're allowing the body's natural healing capabilities to take charge. So this could be as little as 6 minutes of treatment to get the same results that you might need 20 minutes of treatment with the other frequencies to achieve. And that's just because of the unique mix of frequencies and the extra pulses to really get the body's attention. So that's it. It's a nice, simple, and effective treatment for pain and inflammation that is available at your fingertips for your feet. By treating plantar fasciitis with your Avasio Life device, you can kind of shut that inflammation down and trigger regeneration in the tissue, effectively reversing the ravages of this condition. And then, again, if you're going to keep doing the thing that triggered it in the first place, get good shoes. It makes a huge, huge difference. And so, yeah, that's it. Thank you all for joining me today. And as always, if you find this helpful, please like and comment on the video. What I've noticed is that when people like and comment the videos, they get pushed to the top of the page and then everyone sees them. So a lot more people are benefiting from these videos just because you're able to comment and like on it and it bumps it up there. I hope to see you next week for another Monday 10-minute training. Take care, everyone.